Hello and welcome. All the videos in this channel on the topic of research are for concept building. If you can understand the basic concepts, then you can apply the knowledge to research and audit projects. The information is presented by a clinician who has experience in clinical research. If you want to apply the information to your project, then an experienced researcher needs to be part of your team. And you will have to watch this video many times. Data is crucial in the research process as it forms the foundation for analysis, enabling researchers to draw valid and reliable conclusions. The learning objectives for this video include the understanding of the meaning of the word data in the context in which this word is used in research. How do we select what kind of data should be collected? What are the sources for obtaining data? What tools are used for collecting data and how is the data collected? And a summary of the different parts of the research process and the importance of selection of data. So practically, the word data refers to the raw information which is collected from various sources, and this information is then processed and examined to uncover patterns, insights, or trends. So we can understand the meaning of the word data by looking at the following example. In 2015, the World Health Organization recommended using the Robson classification as a global standard for evaluating and comparing cesarean section rates in hospitals. This system places all women into one category based on 5 basic pregnancy-related characteristics. So this means evaluation is based on the following data: the number of previous births, which means parity or gravidity; number of babies, which is recorded as either singleton or multiple pregnancy; past cesarean section by the number of cesarean sections a woman has had in the past obstetric history; start of labor means that whether she had a spontaneous onset of labor or whether she had a cesarean section or whether labor was induced. By pregnancy length, we mean the gestational age, and by baby's position, we mean the presentation of the baby at the time of the onset of labor, which means either breech or cephalic or shoulder presentation. So we also use data as a word in different contexts. And so let us just have a look at the different ways in which this word is used and in which context it is used and what does it mean. So, for example, data selection is a word used or is a terminology used in secondary data analysis, which studies the researcher will choose specific data subsets from a larger pool for a particular purpose. In data extraction, it means involving retrieving specific data from a larger source for analysis or reporting. By data analysis, we mean processing and examining data to uncover patterns and insights. So each of these processes is crucial for managing and utilizing data effectively to support decision-making, research, and operational activities. Other ways that the word is used is when we are describing the data structure. So a variable is a characteristic or an attribute which is being measured or observed in clinical trial, such as age, gender, blood pressure, or treatment outcome. By data point, we mean a single measurement or observation for a variable such as a patient's age, i.e. 45 years, or blood pressure reading. By data sets, we mean a set or a collection of data points for multiple variables, typically organized in a table or a spreadsheet. By database, we mean a systematic collection of data sets designed to store, organize, and manage large amounts of data. Other words used with data is data collection, which means gathering data from various sources such as case reports, forms, electronic health records, or laboratory results. Data cleaning, which means reviewing and correcting errors, inconsistencies, or missing values in the data to ensure accuracy and completeness. Data integration, which means combining data from different sources into a single database, which can ensure consistency and compatibility. Data management uses data in other ways as well, which includes data storage, which means storing the database in a controlled environment with access which is limited or restricted to authorized personnel. And this includes the storage of data in the form of paper or in the computer. By data retrieval, we mean extracting specific data sets or variables for analysis, for reporting, and for further investigation. Data analysis is what we do towards the end of the data collection, where we apply statistical methods and techniques to extract insights, identify trends, and answer the research questions. By data interpretation, we mean that clinicians and researchers work together to understand how the results apply to their patient population. They draw conclusions and then they make informed decisions. So data interpretation is the evidence generation, and it is what is used for making guidelines and consensus reports. How do we decide what data will be collected? Now, this is a very important question which a researcher will ask themselves before they start writing up the protocol. And usually these kind of information comes out after the entire research team sits together and brainstorms and comes up with the answers. So the research question has to be understood carefully, and we have to articulate the study's objectives to guide the variable selection. Looking at similar studies which have been done and which have been reported in the literature will help us to identify relevant variables, outcomes, and measurements. In addition to that, these publications will also contain a section on limitations or weaknesses and errors. And in that, you can identify if the authors wonder that an addition of a certain variable might have made the results more meaningful. Consulting with experts and collaboration with clinicians, researchers, and stakeholders will help to gain insight into essential variables. We need to understand whether the data will be quantitative, which means a numerical value, or will be qualitative. That means will contain descriptive information. We also need to identify primary and secondary outcomes. So determining the main variables to measure, which will help us to recognize the primary outcomes, and additional relevant variables will then be helpful for understanding the secondary outcomes. Further need to identify interdependent and dependent variables. An important question and an important statement and answer that as researchers need to ask themselves and answer is that if the data that they are looking for, is it going to be readily available? And if it is going to be available, what will be the quality of the data? So if supposing the data is not going to be available, or if the quality of the data is going to be very poor, then either an alternate question has to be asked, or the answers may have to come from a different source. An example of this is asking people or asking men their income. Further, we need to also evaluate the variable relationships to be able to evaluate correlations and interactions between variables to avoid redundancy. So after we have understood what data we are going to collect and what information we are going to collect and what variables we have selected, we now have to understand what are the different sources from which we can get this information. In clinical trials, gathering information from participants can be through various methods. And these various methods will ensure accuracy, completeness, as well as the integrity of the data. Some common methods are case report forms. These are the most essential and the most central part of the data recording system. And these may be either paper or they may be electronic and will be used to record participant data such as demographics, medical history, and treatment outcomes. Electronic data capture systems are computerized systems that allow for real-time data entry and automated data validation. An example of this is electronic health records, which may be existing in a hospital, and these computerized systems will have the ability to allow researchers to access real-time data entry. Patient-reported outcomes means that the participants are asked to fill up a questionnaire or fill up a diary and write down what they perceive as their symptoms, their quality of life, or some other experiences such as the kind of care that they have had in the hospital, in the clinic. And they can do this through either recording of this information in a history form or in a questionnaire or diaries. Clinical outcomes can be assessed by trained investigators, which can assess patients and participants' conditions such as blood pressure or lung function. Lab results are a very popular form of source for data collection, and these can be either blood samples, biopsies, or other biological samples which have been collected and analyzed. Data collection include imaging studies such as X-rays, CT scans, MRI scans, or other ultrasound scans. Wearable devices, participants wear devices like fitness tracker or smart watches to collect data on vital signs or activity levels. Mobile apps using for reporting symptoms, tracking medication, or completing questionnaires. Centralized data management, for example, in a hospital where the electronic health record keeping is done, there may be a central data management system. So along with the data collection, it is very important that the source data verification must be done, the data validation must be done, and a high level of quality control should be in place to ensure the data quality and adherence to protocol is being maintained. As an example, if we are going to do a study on urinary tract infection during pregnancy, we may need to take the following data and variables. We may need the age, the hemoglobin level, the level of education, past history of urinary tract infection, parity, gestational age. Laboratory results may include urine detailed report, urine culture and sensitivity, oral glucose tolerance test, serum creatinine level, serum urea level. And exclusion criteria may include pregnant women with a known underlying renal pathology, exclusion of uterine abnormality, chronic renal disease, renal transplant, diabetes, or taking immunosuppression therapy. So now that we have established the meaning of the word data and what are the different sources from which data is collected, let's see how the data will be collected. So the important mention here is developing a tool and methods for collecting data from identified sources. These might involve creating surveys, questionnaires, interview protocols, observation checklists, or data logging systems. The clarity of questions and the consistency of data collection methods will determine the quality of the data. So in data collection for research projects, the CRF stands for case report form. This is a document which will capture all the data required by the study protocol for each participant in a clinical trial or a research study. It will include demographics, medical history, treatment details, and outcomes. And by using this form, we will standardize the data that is going to be taken and that is going to be entered for the purpose of analysis and answering the research question. So an example is that if we are to conduct a trial on induction of labor, then it will require careful consideration of all the various variables to ensure a well-designed and informative study. So some key variables which we might use is, we might define the population to be studied, including gestational age, singleton or multiple pregnancy, and any medical condition that may affect labor induction. The intervention will be documented, such as oxytocin, prostaglandin, or a mechanical method, or maybe a combination of methods. There will be a comparison group that will be taken to define the control group, which may receive standard care, placebo, or any alternative induction method. Then there will be documentation of the primary outcome measures in terms of if the induction of labor was successful or unsuccessful, and what was the time frame for this process, and whether the cesarean section was performed or not, and what was the condition of the baby at birth. We will also have to define secondary outcome measures, which will include maternal and fetal complications, pain management requirements, patient satisfaction, healthcare resource utilization. So as you can understand, that each and every one of these measures is in itself what is an indicator for the collection of data. So for example, for maternal and fetal complications, we may collect a lot of information about patient's temperature, if it was over the normal temperature on day 1, day 2, or day 3 before discharge. Then we may want to know about the mother's blood pressure. What was the blood pressure like on day 1, day 2, day 3 postpartum? And similarly, from fetal complication point of view, also we may need to consider a lot of information. Pain management requirements, patient satisfaction, and healthcare resource utilization. So each and every one of these terminologies actually carrying with it a large number of data points and data sets. So once we have finalized the data to be collected, we will review it again for the following purpose: to determine whether the level of detail that is required has been documented and has been considered. We have to develop a data dictionary to create a document which will outline the name of the variable, the definition of the variable, the format, and the coding schemes. By formatting, we mean that the data entry involves organizing and structuring the data in such a way that it is systematic and it is consistent. So for example, age has to be recorded in a certain way for everybody. It can't be that for one person you write down 39 years and for the other person you write down the date of birth and the month of birth and the year of birth. So this has to be avoided. So by coding, we mean that we can efficiently recognize the variable in a statistical way. So for example, marital status of number 1 would be single, number 2 would be married, number 3 would be for a divorce. So and number 4 would be for a widow. So this is the way that the data is formatted when it is entered, so that there is no confusion. It's important that once we have the protocol ready and once the protocol has been approved, that we go in for a pilot study to make sure that the data collection tools are okay and are recording the information easily, and if any variables need to be added or maybe need to be removed. In the dictionary, we also have to write down that the reason why we have chosen that variable, and if any changes happen during the course of the conduct of the study, then this too has to be recorded in the dictionary. The sample size is a very critical part of the study, because the estimation and the calculation of sample size will be fundamental to the success and the integrity of any research study. It ensures that the study is capable of detecting meaningful effects, maintaining ethical standards, optimizing resource use, and producing credible and generalizable results. Proper sample size calculation is a cornerstone of rigorous and responsible scientific research. Then randomization and blinding are also important when we are considering doing an interventional study or a trial of labor study. We then come to data collection, which means the development of the CRF and the methodology by which the data will be collected and stored and kept confidential. Ethical considerations have to be considered before the study actually starts, but even during the course of the study, if there are any adverse events, they need to be reported to the data monitoring unit, and we need to ensure that no ethical decisions or no ethical concerns are present by the patients or by the researchers during the course of the study. Follow-up is important, and by considering all these steps, we can design a robust clinical trial to investigate labor induction methods and improve maternal and neonatal outcomes. So now we come to the end of our study of this presentation, and we just reconfirm that data is crucial in the research process or in the audit process, as it forms the foundation for analysis and for enabling the researchers to draw valid and reliable conclusions. If the data is accurate and if it is well structured, it will ensure the credibility and the reproducibility of findings, which are essential for scientific progress. And proper data collection and management allows for meaningful insights and informed decision making. Ethical data handling respects participants' rights and upholds the integrity of the research. So with this, we come to the end of the video. If you like the video, please press the like button, send your comments, share with friends and colleagues, subscribe and press the bell icon to be allowed notification of future videos. Thank you and goodbye.